ITP is short for immune thrombocytopenic purpura. So that's an immune disorder of the platelets, and it causes people to have low platelets in their blood, and it puts them at risk for bleeding. And it's an uncommon disorder, but at BCDI, we see a lot of folks with ITP because we specialize in research and clinical outcomes in ITP here. BCDI has taken a very active role in helping the ITP community. Back in 2017, we incorporated this comprehensive care model to help the community of folks with ITP. And that's a multidisciplinary approach. We take care of the whole person, not just their platelet count or not just their bleeding symptom, but everything that impacts their quality of life. And it's been a very positive result of folks that come to that clinic really like it. They get expert evaluation from not just me, but all of our specialists here that really focus on ITP.
I know all of the ITP patients here, so that helps also with continuity of care. And then we have a nurse, our ITP nurse too, and she knows all of the patients. So together with Dr. Tarantino and the rest of the comprehensive care team, just the continuity of care alone. And then we help to improve the comprehensive care clinic, stay up to date on the latest research, medications, help our patients be aware of resources, support groups that are out there on the national and local level. Knowledge is power, so the more that people know about ITP, which we can provide through our clinics, through informal education, resources, all of that, the more that you know, the better treatment outcomes are going to be for the patients. And they know where to go, and if they know somebody who knows somebody with ITP and they don't know where to go, then we're always here, even if you're not from around this area.
With our comprehensive care clinic, we're able to incorporate all of these other specialties to help us take care of the patient as a whole with, physical therapy and dietitians and things like that. And I think that we have found that once we're able to kind of help our patients live all of their life and not just their ITP life, that they kind of have a better outcome. And it's not necessarily easier for them to live with their diagnosis, but it's maybe not as burdening. And I think that if other centers were able to do that, then the patients around the world even would be able to kind of embrace their ITP a little bit better. For our patients that have ITP and their families, we encourage you to talk about it with your peers, and the people around you. You can share on social media about ITP awareness and just kind of getting that out there. A lot of people don't know what ITP is, and there might even be people out there that kind of hear about it and think, some of these things sound like me, and be able to kind of get them evaluated and kind of see what's going on.
I would encourage everybody who knows anyone with ITP or who has ITP to spread the word about what proper care is. Spread the word about this resource we have in PDSA. And for those of you who've come to BCDI and experienced the comprehensive care clinic, spread the word about that, because we really want to have that become the standard of care, not just in Peoria, where we sort of started this concept in 2017. We want the entire country to recognize that as the standard of care. We want to take care of the whole person who has ITP, not just the platelet count of the person with ITP.